Hello, I'm George Kuselius of the Core Institute in Tallahassee, Florida. I'm very happy and honored to be coming to the Lauterstein-Conway School in Austin, Texas this April and May to teach a 6-day program in core myofascial therapy. The certification class includes all of the techniques and protocols that we've been utilizing for the past 40 years in working with our everyday clients as well as top performers and elite athletes. Core myofascial therapy is a subset of structural integration. All of the techniques, all of the protocols come from the 10-session format that Ida Rolf developed over 60 years ago. Core myofascial therapy, though, is done with a 45-degree angle and using leverage rather than power, so the work is much more comfortable for our typical clients. Core myofascial therapy consists of 6 different protocols. The foremost protocol being core myofascial spreading, done with the palm and finger pads of the hand to more stretch and lift the myofascial tissues extrinsically of dense fibrous fascia. Back specific is much more specific for the paraspinals, scapular region, lumbosacral region, and deep hip rotators. Arthrokinetics is a joint manipulation that works with the intrinsic ligaments of the synovial sac and helps to produce greater range of motion in each of the appendicular joints. Foot specific is done for the ankle, dorsal surface of the foot, and on the plantar surface, deeper work for the arches, oftentimes relieving pronation and flat-footedness. Core release is a technique for the sacral tuberous ligament, which allows the pelvic region to find better structural balance. And parasympathetic end work is a series of techniques for the lumbar region, cervical region, cranial, and facial region that allows the parasympathetic portion of the autonomic nervous system to elevate at the end of the session. Core myofascial therapy has been taught for the past 35 years as a program of intermediate structural integration and as a prerequisite to studying core structural integration in Tallahassee, Florida. I'd like to invite all of you to come and visit with us when we're at the Lauterstein-Conway School, and if you're able to, at least take the first 3 days in April. If you're unable to complete the certification program in May, it will be offered both in Austin and in other locations throughout the next year. Core myofascial therapy is also used at XPE Sports during the NFL Combine training and NFL off-season preparatory training that many athletes in the NFL have come to depend on in terms of both recovery and improving from soft tissue injuries. Core myofascial therapy has been used for the past 8 years at Florida State University in the athletic department, initially with the football team and now with 6 other sports. Core myofascial therapy started its athletic movement in 1996 when we worked with the British Olympic team while they were in training in Tallahassee for the Atlanta Olympics. The work was so successful that the British Olympic team started utilizing core myofascial therapy as a part of their training system as more of a prehab than as a rehab. Core myofascial therapy was taught to the 180 therapists at the Athens Olympics in 2004, working with both the Olympic athletes and the Paralympic athletes. Many athletes worldwide have come to rely on core myofascial therapy and utilize its recovery and performance enhancing benefits to a great success. I'd like to invite all of you to come and visit, spend a day with us, spend 3 days with us in April if you're able to, and certainly if the work is as enticing to you as it has been to many others, complete the work this coming May. I want to thank David Lauterstein for inviting me to come to Austin, Texas. I look forward to meeting all of you and working with therapists who are encouraging their clients to become more neurosomatically aware and to benefit from both structural alignment, improving both flexibility, balance, and reducing chronic injuries. Thank you very much. I look forward to meeting all of you.